Head and neck cancer includes mouth cancer, throat cancer, tonsil cancer, various cancers of the tongue or throat, and even skin cancers, everywhere from the shoulders kind of up to the scalp. Also included are thyroid cancers and salivary gland cancers, including parotid and submandibular gland. Depending on the type of cancer you may have pain in an area that you don't normally have, such as maybe your tongue or somewhere in your mouth, or pain in your throat that refers to your ear. That's called referred otalgia, and something that's really important for a warning sign of a potential head and neck cancer. Other things may be a neck mass or a lump that you didn't notice was there before. This can be asymptomatic. It doesn't even have to be related to pain or tenderness or numbness. You may identify a neck lump that you didn't know was there before, and that should be looked at by an ENT provider or even a head and neck provider like myself at the James. I think one thing that's really important about head and neck cancer is that it doesn't always occur in the patients that you might expect, or the patients with kind of the classic risk factors. So for example, smoking is a really important risk factor for head and neck cancer, but about a third of our patients with mouth cancer here at the James do not smoke or have not had a history of smoking. And so it's really important to be aware of a new finding of a neck lump or a neck mass that you didn't know was there prior. Can also be a warning sign of head and neck cancer, and something that needs to be worked up appropriately by, again, an ENT surgeon, an oral surgeon, or even a head and neck surgeon like myself. There's been a rising incidence of HPV-related head and neck cancer that originates in the tonsil and in the base of tongue. And those patients may not have the typical risk factors, such as smoking or even other things like alcohol use. But what they can present with is an asymptomatic neck mass or a neck lump that isn't associated with pain or numbness. This is something you want worked up by a provider that is used to seeing patients with this type of condition.